Hello, my name is Patricia Abraham, and my multimedia innovation business solution is going to be on Smart Souls, which is a GPS tracking device for dementia patients. The assisted wearable GPS technology. This is a miniature shoes GPS tracking device embedded in the heels for wandering Alzheimer's patients and others that may wander. For instance, this can be for young people and adults with autism, and also for athletes and veterans with traumatic brain injuries, and also anyone who is a potential wanderer that requires some oversight. Over 100 million people require oversight due to various forms of memory impairment. This device was created to locate someone who may become lost, such as those following people. The use of electronic device can enhance the safety of older people and help locate people with dementia who get lost quickly and easily, thus reducing their risk from harm. More than one elderly patient with dementia has wandered away from a hospital or nursing home where he or she was receiving care and died of exposure before being found. The advent of GPS technology has reduced the number of such deaths by a high margin. In the event that they wander away from the facility, the device can be activated and the patient located within just a few minutes using a computer with active internet connections. By using this type of electronic device, more dementia patients will be able to stay at home instead of placing them in the healthcare facility. Their families will be saving money that would normally go toward their care to use toward the monitoring of the GPS tracking device, which is a small price to pay for your loved ones. Also, this will give you peace of mind for them staying at home and not knowing what they're doing, because they'll be in unfamiliar surroundings. And mentally, this would help you, and this would also help them because they will be in a familiar place. Families know exactly where their loved ones are at all times without the stress of them being in an unfamiliar place among strangers. The GPS tracking device was patented, featuring a miniaturized GPS tracking device embedded in the soles and powered by a rechargeable battery that lasts 2 to 3 days on a single charge. This device has been recognized nationally and has won many awards. The 2015 CTIA award, they won second place, and in 2015 they won members of a United Nations Global Compact. 2015 AARP, the top new 10 technologies, and also the Connected World Award finalists. The GPS device versus the healthcare organization. In the past, nursing homes have used additional staff and some other type of wireless wonder door alarms to alert them when a patient with dementia is at the door trying to leave the facility. The doors will not open without a code. However, in some instances, the patient learns the codes and are able to open the doors and wander out. Other times, strangers may enter the buildings or visitors, and they don't know who's the patient, who's not, and if they leave the facility, then without staff knowledge, then that will put that patient at risk. The GPS tracking device is a great tool for dementia patients, whether they are at home or in a healthcare facility. They are easily traced and can save lives by alerting and locating the patient within a matter of minutes. There have been several instances when a patient has wandered from a healthcare facility and lost their lives due to some exposure or some type of accident before the staff and authorities were able to locate them. This device can alleviate that tragedy. And I have worked in some facilities where we have lost patients, and everybody has to stop what they're doing to go out and locate that patient. And in some instances in my city, some patients have died because they were not located in time. The GPS device and the healthcare facility. Using the GPS device is the least restrictive and the most preference method of dealing with wandering patients with dementia. It can also be used with traumatic brain injury patients as well as those young people with autism. Many patients affected by these medical conditions have been placed in some type of healthcare facility for their own safety, which means that the healthcare facility is responsible for the patient, and therefore some safety precautions have to be in place to accommodate them. This sometimes can be expensive equipment or code embedded doors or additional staff. These wanted patients' whereabouts have to be monitored on a regular basis, especially if they have the potential to wander off from the premises. That means 24-hour monitoring by staff. In other words, they're going to have to hire some additional staff just to monitor those patients, and then hire some additional staff, to take care of those patients, to help with their medical needs and care. Using the GPS tracking device would eliminate some of this by tracking them with electronic systems. This will be a great investment for the healthcare facility. Also, many reported deaths have occurred due to warning of patients in healthcare facilities, and they are liable for that patient and the exposure by not finding them in time. That the healthcare facility is liable for that. Forming a partnership with the company that provides the service would be beneficial to the patient and the facility and the families. These are some facts. 60% of wandering patients will become lost at least once. 70% of those will become lost at least 3 times or more. And 40% of wanderers are not found within 24 hours will die from exposure and other conditions. That's it. Thank you very much.